Okay, now let's move to Wernicke's aphasia, which is also known as receptive or fluent aphasia. So this condition results from damage to Wernicke's aphasia, Wernicke's area, located in the temporal lobe of the brain. So this area is mainly responsible for understanding language. Unlike individuals with Broca's aphasia, people with Wernicke's aphasia can speak fluently so often, and they also can produce long sentences with a normal rhythm and pronunciation. However, the words they use may not make any sense, and their sentences can be confusing or unrelated to the topic that being discussed. Okay, one of the main symptoms of Wernicke's aphasia is difficulty to understand spoken language. So individuals may struggle to follow conversation, answer every questions appropriately, or understand any instruction. And they may also have a trouble reading and writing because these skills depend on the language comprehension. Some of the common signs include fluent but meaningless speech, the use of incorrect words, and sometimes the creation of made-up words known as neologisms. For example, when asked, "What did you have for breakfast?" And a person might respond with something like, "The sunshine, table runs quickly with a coffee cloud." The sentence sounds fluent, but it does not convey a clear meaning. So it's really not making any sense. And another important sign is that people with Wernicke's aphasia is often unaware of their language mistakes. Unlike those with Broca's aphasia, they may not realize that others cannot understand them, which can make them communicate even more challenging. Okay, to summarize, the main difference between these two types of aphasia is that Broca's aphasia affects speech production, while Wernicke's aphasia affects language comprehension. So people with Broca's aphasia usually understand language well, but struggle a bit more to speak fluently. So in contrast, people with Wernicke's aphasia can speak fluently, but often have difficulty to understand language and producing meaningful speech. Such as if Wernicke's aphasia, when we ask them, "Okay, have you eaten breakfast today?" Okay, so they will ask, "The moon is really colorful, round, maybe flat." They speak fluently, but then it's not making any sense. The sentences is not making any sense. But different with Broca's aphasia. Broca's aphasia, when we ask, "Have you eaten breakfast?" It bread morning. So they can construct sentences, but not a really full sentences like a normal people does. And also, understanding these symptoms and signs is important because it helps healthcare professionalism diagnose aphasia and provide the most suitable treatment and therapy with appropriate support and speech therapy. So many individuals with aphasia can improve their communication skills and quality of life. That's it.